Hello, my name is Dr. Doug Olson. If you are watching this video, then you have decided to make a big step and a large investment in your future quality of life by having a joint replacement surgery. You've decided that you no longer want the pain and stiffness of arthritis to dictate your quality of life and the type of activities that you enjoy. I have created this video in hopes of providing more information to you and alleviating some of your stress and anxiety about your upcoming joint replacement surgery. You can also share this video with your family members and your caregivers who will be caring for you after surgery. In this video, we will discuss all of the aspects of your upcoming joint replacement surgery, whether it be shoulder replacement, hip replacement, or knee replacement. We will discuss the preoperative evaluation, as well as your hospital stay, your surgery, your postoperative care, and also your recovery once you leave the hospital, and long-term expectations. It is important to remember that every patient's case is specific, and this video is for general informational purposes. I would like to discuss with you in much more detail your diagnosis of hip arthritis and the process of your upcoming hip replacement surgery. Typically, hip arthritis pain is significant pain in your groin, your buttock, the front of your thigh, and the side of your thigh. A hip replacement is very good at alleviating this type of pain. Patients with hip arthritis also have significant difficulties putting on their socks and shoes, and typically things such as getting in and out of a car. Again, a hip replacement is excellent at improving your quality of life with these types of activities. It is important to know that sometimes patients also have pain that shoots or radiates down their leg into their foot, and sometimes this is coming from a problem in the back, and a hip replacement may not help with this type of pain. There are, in general, two different surgical approaches that I use to perform a hip replacement surgery. There is the anterior approach, which is less invasive and requires less surgical dissection. During your preoperative consultation with me, I will have discussed with you which surgical approach is right for you and will be able to allow me to perform the surgery safely for you. If possible, I prefer the anterior, less invasive approach, as your recovery is typically faster. However, there are times based on patient-specific factors that is not an option, and I will have discussed that with you. In that case, I use what is called the lateral approach to perform your surgery safely. Now let's take a look at some x-rays of hip arthritis and discuss the surgery in more detail. Here is a representative x-ray of what your hip arthritis may look like. Here we see that the ball and the socket are worn out and the joint space between the two is gone, so now we have the bone-on-bone appearance. There are also osteophytes or bone spurs around the joint, as well as cysts in the bone, which is another way that arthritis shows up on an x-ray. Now let's talk about some of the details of your upcoming hip replacement surgery. When you're brought back to the operating room, typically you will receive a spinal anesthetic. That is when the anesthesiologist uses a numbing shot in your back to help your legs go numb. They will have discussed this with you in the preoperative area with their plan about your anesthetic. I'd like to use this model to show you what happens in surgery. Once I have made my incision and dissected down to your hip joint, we dislocate the hip and we remove the arthritic ball from the socket. This model is showing your arthritis, where these red parts are the areas where the shock absorbing cartilage is worn out and there's now exposed bone. I then have to remove a few millimeters of bone from your socket to help reshape the socket to accept the implant that will go in. This is a representative implant that then gets placed into your socket, and then a new ball on the stem goes down inside your bone, and then we put the hip joint back together. This is what will now make your new hip joint. When closing your incision, typically all of these stitches are underneath the skin and the skin is glued shut. This means that typically there are no staples or stitches that need to be taken out in the office later on. A surgical bandage is applied to your hip, and then your anesthetic is reversed and you're taken to the recovery room. Here is an X-ray representative of a view of your hip after surgery, showing the hip replacement and the prosthesis that we typically use. Here you can see that the socket has been resurfaced and there is a new metal socket with a ball and a stem that goes down inside the canal of your bone where the bone marrow is. There is a plastic liner of medical grade plastic that sits between the ball and the socket. There are a number of things that need to be done prior to surgery in order to prepare you to ensure your best chance of a successful joint replacement surgery. Each of these things apply to you, whether you are having a shoulder replacement, a hip replacement, or a knee replacement surgery. First, you will need to identify one or multiple people who will be your primary caregivers after surgery, as they will want to watch this video as well in order to better prepare themselves as to how to help care for you. The next thing is we will need to obtain medical clearance from your primary care provider. This entails some basic routine blood work, as well as a urine sample, as well as a nasal swab to ensure that you are not carrying a harmful bacteria on your body. If you have diabetes, we will want to make sure that that is well controlled prior to surgery, as this can help reduce your amount of complications after surgery. Also, if you use nicotine, such as from cigarettes or any other nicotine devices, it is definitely recommended that you stop all nicotine use prior to surgery, as nicotine is shown to increase your risk of complications such as blood clots and infection. Now I would like to discuss some of the possible risks or complications that can be associated with your upcoming joint replacement surgery. This is not meant to scare you, but it is important to discuss these things so that you have a firm understanding of the possible risks associated with your surgery. I will discuss some common potential risks that are common to all joint replacement surgeries, meaning shoulder, hip, and knee replacement, and I will also discuss some that are specific to each of those replacements. In general, there is always a risk of infection with a joint replacement surgery. Fortunately, this risk is rare. However, we always worry about the possibility of infection because it can cause increased pain and stiffness and lead to further hospitalization and surgery. We do a number of things to help prevent infection for your joint replacement. Another potential complication is that of a DVT or blood clot. Again, we do a number of things to prevent this, including mobilizing you quickly after surgery. You will wear compression socks on your lower extremities if you are having a hip or knee replacement surgery. We also will place you on a blood thinner if you are having hip or knee replacement surgery. Now, for the vast majority of patients, this will entail taking a baby aspirin or an 81 milligram aspirin twice a day for 4 weeks after your surgery. If your medical history places you at a higher risk of a blood clot, then we may have to use a different blood thinner. Another potential complication is stiffness of your joint after your surgery. This is where physical therapy and your activity level play a large role. Physical therapy is used to help get the stiffness out of your joint and get you as much function out of your joint as we can. There's a very small risk of dislocating a joint replacement after the surgery. Fortunately, this is very rare. In general, with joint replacement surgery, there is also a risk of injury to other structures during your surgery, such as nerves or blood vessels. But again, this is extremely rare. Whether you're having a shoulder, hip, or knee replacement surgery, when you show up to the hospital the day of your surgery, you will be registered at the registration desk. You will then be brought back to the preoperative area where you will meet our excellent preoperative nurses. They will start an IV and likely give you some medication to help relax you. You will then meet the anesthesiologist who will be administering your anesthesia during your surgery, and they will discuss a number of different techniques about the anesthetic to provide you the best and safest anesthetic for you and your medical history. With any joint replacement surgery, the anesthesiologist will discuss a nerve block procedure. This is a procedure done in the preoperative area where the anesthesiologist uses an ultrasound machine to identify and see the nerves around your shoulder, hip, or knee, and then inject some numbing medicine into that area. They typically will place a catheter underneath your skin for shoulder and knee replacement surgeries. This typically stays in for 4 to 5 days and is connected to a ball of numbing medicine. What this does is it blocks your brain's ability to sense some of the pain from your surgery and helps control your pain significantly after surgery. Once all of this is done, you will then be taken to the operating room where you will meet the members of your surgical team. Your anesthetic will begin, and then we will complete your operation. Initially, you will be in the recovery room after your surgery, and after you've recovered from the anesthetic, you will be taken to your hospital room. There, the physical and occupational therapists will work with you and evaluate you. They will show you some exercises needed to obtain a good result from your hip replacement, and they will also make sure that you are safe doing certain activities such as walking and even a few stairs to make sure that you are safe to go home. If you have been selected as a candidate for the anterior or less invasive hip replacement, you may be leaving the hospital the night of surgery and going home. Typically, this is decided during your preoperative consultation. If you are not going home the same night of surgery, you typically spend one night in the hospital and you go home the next morning, typically before noon. If there are any reasons which require you to stay in the hospital longer to make sure that you are safe prior to going home, we certainly keep you in the hospital until that is the case. If it is determined that you require a stay in a rehab facility to get more care, you typically spend 1 to 3 nights in the hospital. Again, this is discussed with you prior to surgery and reevaluated throughout your stay. Certainly there is some pain associated with the surgery, and while you're in the hospital, we will give you appropriate pain medication. You will have compression socks that will be placed on your legs to help with swelling and to prevent the risk of a blood clot. You will also be seen by a non-surgical medical doctor during your stay who will help oversee your overall health and help manage any other medical conditions that you may have. Now let's talk about your expected recovery once you leave the hospital. Initially, you are using a walker to help get around and walk, and usually you use this for 1 to 3 weeks or so. Then you transition to a cane, typically up until the 3 to 6 week mark, when most people are able to walk without any assistive devices. You There is no formal physical therapy involved after a hip replacement typically. Usually you do some simple exercises on your own combined with simply walking, and that helps you get your strength and function back. You will be seen in the office 2 weeks after your surgery, and at that visit we typically take an x-ray to make sure that the implants look good. I will inspect your incision and inspect you for any other signs of possible complications. You also have an opportunity to ask any questions that you have at that point. I will then again see you 6 weeks after surgery, and again, that is to ensure that no complications are developing and that you are progressing the way that we would like. When you leave the hospital, you will be given appropriate pain medication. You should take this to help decrease and minimize your pain, but you should also try to take as little of the opioid pain medication as you need. We also ask that you take a stool softener to help prevent constipation. And I will also encourage you to take an anti-inflammatory such as ibuprofen if you are medically able to, as this helps decrease the amount of the opioid pain medication that you need. Typically by 6 weeks after surgery, most patients are able to return to work if they have a sit-down job or a desk-type job. And if you have a more physical job or you are required to stand all day, usually somewhere between the 6-week mark and 3 months after surgery, you are able to return to work full duty. Also, a commonly asked question by most patients is when they can start showering. Typically, the surgical bandage that we use is watertight and you can start showering right away. The surgical bandage gets removed 5 days after surgery, and then you can start showering with nothing over the incision. We do, however, ask that you do not submerge the incision in water, such as in a pool or in a hot tub, for 6 weeks after surgery, which ensures that the tissue is completely healed. For patients having a shoulder and knee replacement, you will have a nerve block bandage that holds the nerve block catheter in place. This may make it difficult to shower initially for the first few days, but once this comes out, it will be much easier. Regarding long-term expectations, a hip replacement is generally highly successful at alleviating your arthritis pain, typically in your groin, thigh, or buttock. Typically, it allows you to return to a more active life, doing low-impact things such as walking, hiking, biking, swimming, and even skiing. It does not, however, mean that you will never have an ache or pain in the hip again. And we do not recommend that you do high-impact activities such as jogging, running, or jumping. It is also important to remember that you will continue to recover and strengthen your leg and your hip and increase your function up to an entire year after surgery. I hope this video has given you more information and helped alleviate some of your anxiety about your upcoming joint replacement surgery. Please feel free to share this video with your family members or your caregiver. If you have any questions that this video has brought up, please feel free to contact my office, as I want to make sure that you get those questions answered prior to surgery. Thank you for entrusting me with your care, and I look forward to seeing you the day of your surgery.